If you sprained your wrist or are dealing with a wrist sprain, the first thing you want to do is get blood flow to the wrist. Just like with an ankle sprain, you can use a floss band to pin down any irritated connective tissue and temporarily restrict blood flow to get a surplus of blood flow when you take off the band. Wrap it around the wrist and do 10 reps clockwise, 10 reps counterclockwise until you get to 100 or feel a good burn. Another thing to get blood flow to the wrist will be grip training and finger extension training. Not many people train their grip strength, which can lead to weak forearms and wrists, but even fewer train finger extension. You can get a cheap set of these finger extension bands and start working on the back of the forearms. These are also very effective in rehabbing old jammed fingers that still might be causing you some pain. After you do this, you want to start working on wrist flexion and wrist extension. Both are equally important for having strong wrists and forearms. Try to get pain-free, full range of motion, and then progress the weight over time. Then, after you have progressed in these, you can begin training even greater wrist ability by doing radial and ulnar flexion in the wrist, as well as wrist supination and pronation. However, if you are currently having painful wrist problems, I would not start with these last 4 exercises because they are more likely to be painful compared to the first few exercises. Make sure you're never working through any pain and message me with any questions or if you would want to work with me on getting out of pain and reaching your body's potential.